Afternoon, Dr. Trinh. Today we're going to talk about Alzheimer's and Alzheimer's research. But first of all, I'd like to ask a little bit about you. Can you tell me a little bit about you?
Sure. I wear many hats, and one of the hats I wear is being the chief medical officer of a clinical research organization right here in Orange County. And one of our focus in clinical research and with the organization I'm with is actually Alzheimer's. The treatment of Alzheimer's, and the focus is on doing clinical trials to seek new and improved therapies for memory loss, for Alzheimer's. But on top of that, I do a lot of health education where I'm in the community and educating patients, educating physicians and healthcare workers on reducing the risk for Alzheimer's. And many of us don't realize that there are things we can do with our lifestyle, with our diet, with our physical activity that may reduce the risk for Alzheimer's. And in a nutshell, that's kind of my role and what I do.
And how did you get started in doing this, Dr. Trinh?
I had taken care of patients for probably about 17 years in clinical practice. And the majority of my patients are older adults where as an internist, we take care of diabetes and high cholesterol and heart disease and cancers. And over the 17 years of taking care of patients, I was successful in reducing the risk of heart attacks. I was successful in reducing the risk for cancer. I was sending patients for their mammograms, their colonoscopies, and pap smears and all that. But the one thing that stands out is that every time I made the diagnosis of Alzheimer's, I felt that it was a one-way road. And so as you know, we don't have a medication that successfully stops or reverses Alzheimer's currently. Nothing that's FDA approved for over 15 years now. And so it was an emotional impact on my patients and myself because that was one condition that I felt somewhat helpless. We didn't have a medication that worked. And so a few years ago, I decided to step down from a full-time medical practice, being the medical director of the facility and the organization that I was with, to become a health educator. I wanted to go out and teach folks on the things we can do that is evidence-based, that is supported by research to reduce our risk for the plaque, the Alzheimer's plaque. Have you heard of the Alzheimer's plaque, Edna?
Yes.
Right?
Yes.
We call it amyloid plaque. Mm-hmm. And there are things that we can do to minimize that risk. There are things that we can do that has been shown by research to minimize our risk. And so that's, an overview of kind of how I got involved into this space. And this is kind of, I guess, a little taster of what I will be talking about when we have the opportunity to discuss this for a little bit more time, for about an hour or so with future lectures with you guys.
Great. What can you do to minimize the risks of Alzheimer's?
There are a number of things that can be done. I'm going to give you a high-level overview. Mm-hmm. It includes nutrition. Mm-hmm. It includes physical activity. It includes brain activity or brain exercise. It includes minimizing our risk for certain health conditions. Mm-hmm. For example, if I had 10 patients with Alzheimer's, 8 of those 10 will have high blood pressure. If I had 10 patients with Alzheimer's, 4 of those 10 will have diabetes. 3 out of 10 will have heart disease, and many will have high cholesterol. So these association with other conditions and other diseases will link and increase the risk with Alzheimer's as well. So those are the few things that can be done that we can address with our lifestyle, with our nutrition to lower those risks. So that's kind of an overview, kind of like a high level overview for you of the things that we can do. And when we do the full-on lecture on this, we'll get into the details on how to manage all this.
Well, thank you very much, Dr. Trinh, for being here today. We appreciate you, and we look forward to a longer session getting to know more.